The National Assembly grills the federal government on monkeypox. I'm Blinda Akibe, and you're welcome to the Gavel. Now, more than a week after the outbreak of monkeypox in Nigeria, federal lawmakers in both chambers of the National Assembly are demanding a well-thought-out plan from relevant government agencies to tackle this disease. The Senate Committee on Primary Health met with the national coordinator of the Nigeria Center for Disease Control to gauge the agency's response to the disease. More than a week after the outbreak of a suspected case of monkeypox in Bayelsa State, as of Thursday, October 12, 2017, there are now 33 suspected cases of monkeypox in 7 states, including Bayelsa, such as Akwa Ibom, Rivers, Ekiti, Lagos, Ogun, and Cross River states. The National Coordinator, Nigeria Center for Disease Control, Dr. Chikwe Ihekwazu, presented this information to members of the Senate Committee on Primary Health.
Rapidly, and this is why we have to send the samples to Dakar.
He appeared before the committee during the week to brief lawmakers on the response of his agency to monkeypox. During the interaction with committee members, Dr. Ihekwazu disassociated his agency from any immunization exercise against monkeypox in the southeast and other parts of the country, and warned Nigerians against participating in any immunization exercise against monkeypox.
What happens with monkeypox? It's caused by a virus. The virus normally circulates in animals. And from time to time, it jumps over to humans. The animals are rats, squirrels, and what we generally call bushmeat in our sociocultural context, where the risk to humans is not actually in eating the meat. The risk to humans is in preparing the meat, killing it, cutting it, and not cleaning or washing your hands properly. And then when you put that, your fingers in your mouth or eyes or something, the transmission can happen. So we have a cluster. This disease is not as bad as it looks, but it looks fairly challenging because it leaves you with significant spots on your face and on your palms and on your soles, and reminds people of the era of smallpox. But the truth is very few people die from monkeypox. In fact, we haven't recorded a single death among the cluster in Bayelsa. This gives credit to a lot of the work done by the Bayelsa state government and our team that has been working together to curtail the spread of this outbreak. Now, there are many diseases that present like smallpox, have a significant skin rash, and because we went public at the end of last week, what we have seen are a lot of reports from various states. We're investigating each of those. There are 7 states that we've got reports from, and that's why we made the press release and said we have 33 suspected cases across 7 states. We're going to update that by tomorrow. We have already discarded a lot of the cases that have been reported. They have been investigated. We have seen that the symptoms are not similar to what we expect in monkeypox, and we're discarding them. By tomorrow morning, we'll send out an update. So around this specific cluster of monkeypox, I want to assure colleagues that it's under control. The biggest cluster is in Bayelsa. We don't think all the other cases being reported across the country are monkeypox, but we have a responsibility of investigating every single one of them. So we're working with the states, the 7 states, to rule them in or out, while focusing primarily on supporting Bayelsa State in the response. So at the heart of the response today is an emergency operations center that we set up at the Nigeria Center for Disease Control, where we're coordinating the entire response, getting information from states, advising them on what to do, how to manage, what samples to collect, collecting those samples and sending them to the 1 lab in Nigeria and 1 in Dakar that is doing the diagnosis for us. Monkeypox is a very rare disease. It last occurred in Nigeria in the 1970s. So most labs don't have the capacity to make this diagnosis. There's only 1 lab in Ede, the Redeemers University, that has the capacity to do the diagnosis in Nigeria. The other lab in West Africa is in Dakar. I want to state categorically, there's no monkeypox vaccination. Do not participate in any monkeypox. But there are other vaccines being delivered all the time to prevent diseases in our children, but nothing related to monkeypox. We're not carrying out. And as far as I know, there's no agency of the federal government that is doing this, civilian or military.
Giving an update to committee members on the agency's response to the disease, Dr. Ihekwazu disclosed that there is no public health institution in Nigeria that can diagnose monkeypox.
Our absolute priority is to develop our public sector laboratory services, the labs to diagnose the diseases. This is our biggest strategic challenge. At the moment, the only lab that can make this diagnosis is the Africa Center for Genomics, which is a part of Redeemers University, which is a private sector laboratory, not for profit. There's no public sector lab in Nigeria at the moment that can make the diagnosis of monkeypox. So at the moment, we have a total of 33 cases. 17 are in Bayelsa. Out of that 17, we think that we have monkeypox within it, but we haven't confirmed any yet. Across the other cases from the rest of the country, we think will ultimately not be monkeypox, but let's wait until we have the results to be very clear on that.
What we are mandated you and coming out of this engagement is that in this 2018 budget, let's have full costs of setting up a full reference diagnosis center, one in each geopolitical zone. One in each geopolitical, because it's important. Now, like I said, from 22nd to today, how many weeks? We are still treating people on assumption because we don't even know what the infection or the disease is as we speak. It's just that they are manifesting symptoms that look like monkeypox. And like you've also told us here that even several other states are reporting and you can't confirm whether they are monkeypox or not. And if this was an infection that was had a fatal rate, by today we would have been wiped out while we are waiting to confirm. And like you said, going to Dakar is a French-speaking country. Maybe when the result will come, you will now need a translator, an interpreter, to translate what they have, the result, because they will write it in French. You can see our dilemma. So we are saying here, when you go back, relay with the ministry, and that this is our instruction, because the budget for 2018 is yet to come. Now you are talking of Gadua lab, which is the one you are about to have, because you don't have it yet. Because building is not a lab. It's not, from what you've said, yes, but it's not been well equipped. And it's going to be part of our oversight in the next few weeks, because we're going to go around oversight. So be prepared for us to see the Gadua lab. Then we'll see if that is going to be a model that will be replicated in all the other geopolitical zones. Fine, but we need a costing. We need to know what it will take this country at least to establish one reference, diagnosis reference, so that we can get out of this shame and embarrassment, because I believe it's an embarrassment that for so long we can't determine whether it's smallpox or chickenpox or whatever.
Meanwhile, the Senate is asking the Federal Ministry of Health, state and local governments to be more proactive in containing and preventing the spread of monkeypox across the country. The upper chamber also wants government at all levels to embark on aggressive enlightenment and education of citizens about ways to reduce exposure to the disease.